Dear audience, I'm Dr. Pekka Pinola and I come from the University of Oulu from Finland, and I'm here to present our study Polycystic ovary syndrome and leukocyte telomere length, results of a cross-sectional and longitudinal analysis in a birth cohort study. First, some background. As we know, the telomeres are DNA protein complexes that protect the chromosome ends from the DNA damage and act as an indicator of cellular aging. There is a reverse association between age and leukocyte telomere length. Telomeres and morbidity. We know that short telomeres are connected with earlier onset of Alzheimer's disease, cardiovascular diseases, osteoarthritis, osteoporosis, and diabetes. On the other hand, long telomeres are associated with certain cancer types. PCOS and telomeres. Polycystic ovary syndrome is the most common endocrine disorder in fertile-aged women. PCOS is associated with metabolic morbidities such as cardiovascular diseases and type 2 diabetes. Women with PCOS are affected by comorbid conditions such as obesity and chronic inflammation, and these are also associated with a shorter LTL. Until now, however, there are only few comparative studies and no follow-up studies on telomere shortening between women with PCOS and controls. And these studies have controversial results. Our study. Our study question was, does mean relative leukocyte telomere length, LTL, or longitudinal change in LTL differ in women with PCOS in comparison to controls? Our hypotheses were first, PCOS women would have shorter LTL. Secondly, that the attrition rate is greater in PCOS women when compared to healthy women. And third, shorter LTL is significantly associated with metabolic risk factors in PCOS and in control women. Our study was conducted in a population-based Northern Finland birth cohort 1966. The cohort includes all live births during 1966 in the two northernmost provinces of Finland. The subjects have been followed from the pregnancy and delivery until the age of 46. We used the data from questionnaires and clinical examinations at ages 31 and 46. Our study population. We measured LTL at both ages 31 and 46, almost from every subject. The PCOS was defined as follows. At age 31, women who had oligoamenorrhea and hirsutism were defined having PCOS. At age 46, it was self-reported PCOS diagnosis. In the end, we had 207 PCOS subjects in our population. The controls were women without PCOS-related symptoms or diagnosis. For the methods. For the measurement of LTL, we used the monochrome multiplex quantitative PCR, which is currently the most used method for measuring LTL. Since LTL was measured using a different reference DNA sample at ages 31 and 46, this was standardized with a set score separately for each measurement. And for the results, we found no significant difference in LTL of women with PCOS when comparing to controls. In the upper table, you can see the results at age 31, and in the lower table, you can see the results at age 46. We did some adjustment in the model 1. We adjusted the results with body mass index, and in model 2, we adjusted with body mass index, alcohol intake, smoking, and socioeconomic status. The adjustments did not change the results. We did some correlations between LTL and anthropometric, metabolic, and hormonal parameters. At age 31, only a weak negative correlation between LTL and BMI and LTL and waist circumference was found. At age 46, we did not find any significant correlations. In the longitudinal analysis, we looked at the mean difference of LTL Z-score between ages 46 and 31. In the PCOS group, we did not see a significant change, whereas in the control group, we saw a significant decrease. So no significant attrition in LTL of PCOS women, but a significant attrition in LTL in control women. And conclusions. We had some unexpected results. So we found no significant difference in LTL between PCOS and control women at ages 31 and 46. We also did not find significant LTL attrition in PCOS women. In contrast, however, we found a significant LTL attrition in control women. And for some discussion, first, could this finding be related to the later menopause observed in PCOS women? Could the higher levels of estrogens and anti-Mullerian hormone have a role in this? And secondly, could the better stability of LTL in PCOS confer a protective effect against aging in PCOS women? And thirdly, could this finding partly explain why the women with PCOS, despite their numerous metabolic risk factors, do not seem to experience as many cardiometabolic events as expected? The mechanisms underlying these findings remain to be clarified. And lastly, I would like to acknowledge our research group here in Oulu and also our collaborators from London and Helsinki, Finland.